Elizabeth Ashbourne. I am the Executive Director of PQMD. And today we have Kristie Porcaro with us, who is the Chief of Strategy and Partnerships at Operation Smile. This series that we are doing is called People of PQMD. And since we are all in our homes and not able to actually interact with each other directly, these videos and these short discussions with our colleagues hopefully give everyone an opportunity to get to know the people of PQMD a little bit better, and then have all kinds of things to talk about when we finally get to be together in the same place. So Kristie, thank you so much for doing this today, and thank you for joining us, and we're really excited that you are here.
Thank you.
So just going back to your background,
Sure.
Kristie, I know you have a background in nursing and a BSN degree. And then before joining Operation Smile as official staff, you worked for a consulting and fundraising company in New York City, working with clients such as UNICEF, Doctors Without Borders, Pace University, and the Public Theater. So I'm wondering, how did you find your way to Operation Smile?
Sure. Thanks, EJ. And really, honestly, we are privileged to be here. Yeah, like you said, my life began in nursing. I went to Villanova University, grew up in the South, and, went to the North for school, and it kind of just opened my eyes. And, I loved nursing. I loved helping people. I loved helping families. Did a little bit of that career after college in pediatric oncology. Realized that I loved the whole child, understanding what patients and their families went through, really being there for the parents and these patients in a time that they were really pretty desperate. I think fast forward, I really felt like nursing was a great career for me, but I wanted to take on something a little bit different. So I ended up in New York City, working for an organization, a company called Community Counseling Service Fundraising, CCS. And it was amazing. I learned about fundraising. They kind of threw you out there a little bit in the beginning days. And I learned so much about fundraising through UNICEF and working on board development. Through Doctors Without Borders, I taught people how to ask for money through major gifts. In the Public Theater, I did a feasibility study on if they were ready to raise money. And then in Pace University, I did research. But, it was other stories that I told, and it was fantastic. And I love to teach people. I love to talk about fundraising. But uniquely, I grew up with Operation Smile. I was 6 years old when the organization started. My parents are the founders, Bill and Kathy McGee. And I kind of yearned for that, my own personal story. Some of you may know my parents, but they don't really roll out the red carpet for the five of us. You kind of have to earn your worth a little bit, which has been, rewarding, and I think really helpful for all of us as we've grown in our careers. But I missed telling my own story. I was 6, like I said. I was 8 years old when I went on my first medical mission to Colombia. So uniquely, our head of development came to my dad and he said, why is your daughter raising all this money for other organizations? Why can't she come and help me? I really need some help in the fundraising world. And my dad said, well, Carlos, if you want to hire Kristie, then you have to hire Kristie, but I can't be a part of the hiring process. So back and forth a little bit, I came on board 15 years ago and have played really unique roles within the organization, always focused on fundraising. And really looking at the gaps and working with our countries out there, our foundations, our partner countries, really focused on major gifts, but then on the corporate partnerships piece. So spending the last 15 years in kind of that world, and really excited about the momentum that we've built as an organization, and really just telling the bigger story and the global story.
Thank you. That is really an exciting background, and what a fantastically diverse amount of experience you bring to the organization on a whole range of different fronts. So how would you say that growing up with the organization, sort of in the rearview mirror and now in front of you, impacted you in your perspective?
So, the story that I kind of shared today, because I would say 38 years later, things happen in your life. But if I reflect back on my first medical mission, we call them surgical programs now. But I was, around 10 years old, and I had the opportunity to travel to Manizales, Colombia with Operation Smile. And my parents actually took all of us. So there's 5 of us. And they took all of us because they really wanted us to experience the world. They thought the United States was great, but that we really needed to get out there and see the need that existed in other countries around the world. And I can tell you, it still kind of hits me today. But we went and we played with the children. We got a chance to go into the operating room, of course, and see a child's life changed. And at 10 years old, I can tell you that it really hits home. But I remember after playing with all of these children, they were burn children that we took care of, and they were orphans, and they stayed in one room in the hospital. And my brother Trevor and I was 10, he was 12, would come in every single day and we would play, just like 10-year-olds and 12-year-olds play. My dad taught us how to actually clean their wounds and kind of redress their wounds. And then, we would get on with our day. And about 5 days in, we ended surgery, and I think Trevor and I started talking, and we were kind of sitting on the stairs and we started to cry. And my dad kind of ran over thinking, what's wrong? What's wrong? My children are crying. And he came over and he said, what's wrong? He was like, why are you crying? And, we said, well, who's going to take care of these children when we're not here? And so I think that even at 10 years old, it can really make a lasting impact on you. And our life was not normal. We had patients living in our homes, big cases. My dad was a craniofacial plastic surgeon. So we had World Care patients come over and stay for 6 months. One patient was 16 years old. He had his entire face eaten away by a disease called Noma. And he lived with us. He lived with our family. He went through stages of his operations, and our Thanksgiving Day table was surrounded by patients, medical volunteers, sometimes donors. People slept in our beds. We slept on the floor to give them, the ability to, have a bed. So it was a very unique childhood. But I can say, 38 years later, having children myself that are pretty much the same age, we were really blessed. My parents always taught us to be humble, to really care about the world, care about people, really be kind and get to know people, listen to their stories. And I think a lot of that is because of the experiences that we've had with Operation Smile growing up, and the experiences now that I can pass on to my children and into also other people's children.
That's really, really beautiful. And what a wonderful way to grow up, even with the challenges and difficulties. But what a vast amount of experience you bring, not only to Operation Smile, but to all of your colleagues and partners and organizations that you get to work with and who get to work for you. So thank you for sharing that. Really,
Thank you.
Incredible. So just turning a little bit to today's situation and what's going on with COVID-19 and the kinds of limitations that COVID is placing on all of us, not only on our personal lives, but also just practically speaking with the kind of work that we do, and especially the kind of work you do when you go out around the world and provide all these services and this critical care for surgeries and for people around the world who are desperately in need of it. So how has COVID impacted your work and
Sure.
has it changed the way you deliver care to patients around the world?
I think it's impacted all of us. I think all the organizations at PQMD. I think the nice thing is that, through your leadership, EJ, we've been able to collaborate and communicate frequently with our partners through PQMD. So really thank you for what you have done and what PQMD really stands for. We've had to make some hard yet smart decisions as an organization. I think the unique thing about Operation Smile has been that we've always gone into a country really partnering with medical leadership, partnering with the Minister of Health, and really building trust and friendships within the countries that we've worked within. So even though our medical programs haven't been able to or have halted during COVID, we've had staff, in our global offices that are working virtually. And kind of despite these new normals, we continue our promise to care for children and their families. And we're working to keep people safe and healthy during the pandemic and really providing support to them. So whether it's through PPE and equipment and supplies, a lot of our partners through PQMD have been there for us and have, continued to support us with the supplies and equipment that we need to do things safely. We're helping frontline healthcare workers stay safe, nourished, empowered to better serve the patients that we provide life-saving supplies and equipment to. So I think that that's something, in the United States, a lot of our students, student ambassadors have brought supplies, but also food to families in the United States. But I think the story that really kind of touched me was, and this is kind of talks about our self-sustainability and what we've been able to do within the countries, is the story about our volunteers and our staff within Madagascar. So, they came together and they worked with our teams in the United States, and they said, our patients are out there and they're far out there, in the country, and they need nutrition. They're not eating, they're not able to get the supplies that they need to be healthy. So why don't we come together with a team and go to the outskirts of Madagascar where our patients are? And some of these trips were a week, where they would go out, and it was called Extra Smiles campaign is what they called it. And they were able to get, washable cloth masks to these patients. They were able to get hand soap. They were able to get educational brochures of what, is being safe. They were also able to give food for these families. And, within kind of a couple weeks, they were able to reach all of these families and really bring them the critical supplies that they needed to be healthy and safe. And I think that that's just one example of the many programs that we've been able to continue to run. Just recently, we actually were able to start back on some of our surgical programs. So Vietnam did their first medical mission where safely they took care of over 60 children. Thailand is now starting to get back and start to do its first surgical program. China will follow. So I think that Operation Smile during this kind of time has worked with our partners, but also has provided equipment and supplies for the frontline healthcare workers that need it within our country. There are volunteers, the 6,000 that we have all over the world, but they also have been able to really help our patients and support, what is, kind of these families out there that we care so much about. So yes, COVID has kind of changed the way that we've thought a little bit. We'll still run surgical programs as an organization, which will be really important. But I think that as our 40th anniversary comes up in a year and a half, you'll see the organization make a little bit of a shift, really focusing on infrastructure and health system strengthening within some of our key countries, really partner and collaborate with a lot of organizations and companies out there to elevate the healthcare and the surgical care that is provided, to the world and to their district hospitals across different countries. So I think COVID has allowed us to really think a little bit differently, push ourselves, but also really work with partners on the ground and our established foundations to continue caring for our patients and our volunteers and our healthcare workers on the ground.
Thank you. I would agree with you, and you have that in common with a number of other organizations within PQMD, that COVID has really shown a light on the fragility of health systems around the world, but also in our own backyard. So
Right.
it's been a very interesting development and trend that I think was already going in that direction, that people were really looking at not only approaching humanitarian crisis or disasters by
Right.
providing urgent care, but also really planning or selecting and prioritize and planning for future investment in the countries to which they were going and working in.
Right.
And it was really all about health system strengthening and sort of staying there for the long term, and really understanding the capacity gaps that are there, and the need to fill them on a sustainable basis.
I think too, EJ, just to also comment on that, I think just like a lot of other organizations out there, it's about relationships, and I think that actually goes back to the value of PQMD. We build relationships and, through some of the meetings that we have. But I think a lot of us have been able to really reflect on, it's going to take all of us out there, right? They say 5 billion people lack access to surgery. We know that there's 5 million children out there that are in need of cleft lip and cleft palate surgery. So, but it's also about education and training and being able to think outside of just cleft surgery and really on, what are the bellwether procedures, and do these healthcare workers within these hospitals have the right training to be able to, take on some of these bigger surgeries that are important to be done. So I think as an organization, like I said earlier, along with a lot of partners, I think we can tackle it together. And nothing is too big if we're all working together.
That's excellent. So you were recently promoted to Chief of Strategy and Partnerships within Operation Smile. So congratulations
Thank you.
for that. And tell us sort of briefly, what do you hope to do with that new role?
Sure. So, it's just like I said, my parents never rolled out the red carpet for us. This is something that took about a year, and it's been a lot of conversations back and forth. And, for me, when I take on something, I really take it on 100%. And so, we really thought through the role collectively with a lot of other chiefs within the organization. I'm really excited, honestly. I leave the fundraising world a little bit just, after 20 years, which is hard when, you love what you do. But I think the value that I can bring to this organization is I've always looked at the gaps. I've always looked at where maybe countries need us. That's always been my kind of, I guess, strength. I really care about people, no matter if it's our patients or our colleagues out there. And so my new role, it's Chief Strategy Officer and Partnerships. And I'll really be focused on being the collaborator, being the convener of people, really bringing people together around our 40th anniversary. My parents have written what is called the guiding principles, and it's kind of their legacy that they leave to the organization as we move forward and we drive things. So how do we launch that? Just like J&J does with their credo and other organizations do with their mission, their vision for the future. And so I'll tackle that. I'll also build an advisory committee globally for the organization, really working alongside a lot of colleagues globally. I'll also really, I've taken a holistic look over the last year and a half of certain countries where I go in and I really say, do they have the right board members? Do they have the right executive directors? Do they have the global story, or are they telling the global story? Do they have the right programs in place? Are they partnering with the Minister of Health in ways that are really kind of looking at surgery across a country? So I've done that in Colombia. I'm on the board in Colombia now, and I'll probably take on another country or two and really look at that the same way. So, I think it's more of a strategy role. And partnerships is there because I love working with our corporate partners globally. And there are some legacy ones that I'll continue to drive forward. But really trying to look at the gaps and the strategy for the organization in a collaborative way moving forward. So I'm excited for the change. Doing this for 20 years, sometimes it's nice to take on something else. And I know this organization is really strong. We've got incredible colleagues out there globally, and it's really just bringing the right people around the table as we drive things forward and we launch into our 40th anniversary.
You've mentioned a couple of times how you think PQMD can support that agenda. And I personally see quite a lot of alignment with the kinds of things that we do and the kind of direction that we're going as a coalition. So I first will say I look forward to expanding our relationship with Operation Smile and with you, and really supporting the kinds of things that you're doing in those relationships, helping to deepen those relationships and make them as productive as possible for the kind of work that you're doing. So but as a member of PQMD, and
Sure.
you haven't been a member that long, so at least it was during my tenure of the last 5 years. So that's kind of exciting to have the opportunity to see the relationship grow similarly to my own experience. But how do you see PQMD really helping you reach the goals that you've outlined?
Sure. I mean, I think that, EJ, you've done a really amazing job, I think, as a leader. I think that you've brought kind of to the forefront health system strengthening. Disaster relief is really important, especially in our world today. I always feel like things, whether it's earthquakes or just bigger disasters are happening for us, and those organizations are crucial as we move forward. But I think surgery is also something that, is also important, because if some of our patients aren't able to have surgery, then they're not able to kind of give back and get back into their society and help their society flourish. So I think what you've done is really puts health system strengthening to the forefront, where we've brought on some other organizations that have been able to talk about it and educate a lot of our corporate partners into why health system strengthening is so crucial as we move forward. And I think a lot of us, and during some of your meetings, you're talking about 5 billion people and what the Lancet is doing and what WHO is doing. So I think what I would say to you is continue those conversations, allow Operation Smile to share with some of our partners what we've seen within 38 years of working in these low middle income countries. Utilize the skill sets that we have within the countries that we work within, and let us all gain insight together of where is the bigger problem that I think collectively, like I said, that we can all solve together if we join forces. I think there's a lot of talent within PQMD. People have been members for a long time. I think bringing up great discussions like we have, understanding where the challenges are that we all face together, and then how can we move forward. So I would say you've done a beautiful job. I would say that continuing these conversations and really gaining insight from the field is the way that I would move forward, so that we can all learn together from a lot of our different partners, but also from our healthcare providers within the field or our staff in the field as we move forward.
Thank you, and thank you very much. I'm glad that the organization is able to serve not only your organization, but all the members of PQMD in an effective way, particularly during this difficult time. Again, I just really appreciate all the things that you've said, and look forward to continuing to work with you. So I actually just have one last question.
Sure.
So I know, and you mentioned that you come from a big family and that you yourself have a big family and young kids. So I'm wondering, what sorts of things are you doing for fun?
So I love to be outside. I love nature, even around some of the, the pandemic we've been through. My husband and I take a walk every night together, which has been something that we've never done in the past. We ride a lot of bikes. We go to the beach. I love a little bit of an adventure. I have 3 boys, 12, 10, and 6. So they provide a lot of excitement. We also got a dog during COVID. It's the girl that I brought into the house. She's adorable. She's a little golden doodle. But I honestly, anything outside, it gives me energy. I like to take on new adventures. Being in Colombia, now being on the board, I love to travel. I love to travel with my kids. Being on the water is something that I think we all enjoy. Unfortunately, we were supposed to go, and I know, EJ, you love boats and sailboats. So we were supposed to be on a catamaran in April in British Virgin Islands that we were not able to do, unfortunately. So the goal would be to get back, being on the water, enjoying the kind of sand and the sun, with a little adventure built into it would be my kind of ideal adventure and travel, and something I would love to do with our kids. And then I also just love to be with my family. There's 20, I think 6 of us now all together. So there's 14 grandkids, spouses, and, we just all love to be together, enjoying each other on some adventure. So.
What a wonderful, wonderful community. So Kristie, thank you so much
Thank you
for your time today and for the excellent interview. I really appreciate everything that you said. And I think that PQMD will really be surprised at the kind of depth of experience that you have that I am not sure that any other member of PQMD actually brings to the table. Certainly starting from 8 years old and all of that life experience. So, so may you continue to put extra smiles on the faces of your family and all that you work with. So
thank you. And we're excited. We're in, we pull volunteers from 60 countries, and we're in 30 countries globally around the world. So we'll continue our work. But I think, just like I said earlier, it's a lot of collaboration. And I think that we're in this all together, and there's just a lot of need in the world, and feel really blessed every day to be part of it.